Thank you for staying with us. And here's a way to say goodbye to those stubborn fat and hello to the body you've always been dreaming of.
In aid and mission to boost self-esteem in overweight individuals, the Beverly Wilshire Medical Center delivered the ultimate body transformation post-massive weight loss with Tiger Matrix, world's first of its kind breast and body lift. Renee Thornton of Australia travelled thousands of miles to regain her self-confidence to achieve the body she's proud of.
As a child, in Australia, for a portion of my childhood, I was brought up by the state. I was always a bigger child, or out of all my group of friends, always the bigger child. When I was 16, I moved out on my own. My weight issues really began then because I was cooking for myself and shopping for myself, and living on your own at that age is very stressful, and I didn't really know a lot about it. So I had my first child when I was 19, and my weight I felt like after every child I had, I put on more weight. And I met my husband, and he used to tell me all the time, I love you for what you are, and I don't want you to change, and that made me comfortable and happy, and I ate more. So I just got bigger and bigger and bigger. And my heaviest weight was 170 kilos, 170. In 2004, after trying every diet club that anyone could ever think of, I found on one of a TV program at home, they were advertising or talking about the lap band. I figured that was my last chance. I wasn't sick yet, I didn't have diabetes, I didn't have high blood pressure. Within a week and a half I had the lap band put on, and I lost weight from day one. I got to about 110 kilos, so I'd lost 60 kilos. And I was watching my skin get droopy and everything was just hanging in the wrong direction. I believe that if the Tiger Matrix wasn't there, my wound or my scars may have been wider because of the pulling of me getting up and down. But with the Tiger Matrix, it's like it was holding everything in place, so it wasn't pulling. So I ended up with a scar that looked like somebody had drawn a pencil around me. It was so perfect. I like exercising now because having skin, it was very difficult to exercise. So yeah, I like dressing up now. I get lots of comments at work at how different I am now when I go to work. I'm just proud. I'm proud to be in the body that I'm in.
These multiple breakthroughs in plastic surgery with Tiger Matrix, comprised of safe healing process, improved with revolutionary medical technology.
Our tissues, due to maybe age, external factors, genetic, maybe trauma, so they become damaged or destroyed or become weakened. Right? Now, when that happens, so that will cause imbalance into our body system. For example, with aging and with pregnancy, lactation, for example, the woman, the breast will start sagging because the tissue quality drops. So the tissue content that hold, the content of tissue that hold the tissue together, let's say the breast up there, now it's gone down, is gone or become much less. So you lose, a lot of this elastin and all these good tissue that actually bind things together in your body. When you have that, then problem will occur like hernia and also bulging of tummy. Then your body is out of shape, and then you can, your clothing don't fit and you don't feel good. Self-esteem is low. So you need to repair that. You need to bring back to so-called normal situation or normal level, and that's not easy because you need to stimulate the cells that is there to become stronger. So we have done things like repairing by using sutures, or you have used mesh, which is non-absorbable, meaning that the mesh will stay for the rest of your life in your body. But we found out a lot of problems, a lot of concerns. Like when you have any foreign materials in the body, chances of infection is higher. Chances of it protruding out is higher, and chances of it being rejected totally is also high. So because of that, then they developed this new so-called mesh or new matrix to call it, and this is called Tiger Matrix, TIGR. Now it has been developed so that it is absorbed by your body eventually. It will take about 3 years. So if you put into your body, then in 3 years time it's gone. But what is left behind is a legacy of this, meaning that it will stimulate growth of tissue into this. You can see all these tiny holes, and that stimulation will cause good tissues to go in. These are the tissues that actually bind things together. It strengthens. Let's say you put it on your tummy, for example, in a tummy tuck. Tummy tuck means you have that excess tummy apron after pregnancy, so when you're so obese, so we remove that excess skin and we repair your muscle. So what we do last time, we just stitch the muscle together. We found out the effect is still not as good as you expect, to give that nice tight tummy. So what we'll do is we put the mesh above the muscle. This is what we're talking about, under the skin there, and we stitch this up and we close back the skin. Now, without you realizing it, without the patient realizing it, your body is acting on it. Okay, so it stays inside there. You just do your normal activities. The new cells will go in there now. So the cells that go in will strengthen that muscle. So same like for your breast. Let's say your breast has sag. So you can put it under the breast tissue there, inside, under the skin, and new tissue will go in. And that tissue will make sure that the breast will stay there for a good long period of time. Of course, it comes also with risk. Any foreign material, no matter whether they're absorbable or non-absorbable, this is absorbable, I mean your body will absorb it. They will still have higher risk of infection, higher risk of this being rejected, higher risk of this cause problems in terms of the body will incorporate to the wrong place. So that's always happening in any foreign materials. But the good thing, because it's absorbable eventually, that means your body will absorb it eventually, so the chances is low as compared to the traditional mesh that we have used in the past. So that's the advantage of it. Strengthen the tissue where you want it to be strengthened, which we could not do in the past.